There is a number many people over 60 wait for when they think about blood pressure. They imagine danger starts only when the reading looks extreme, something so high it feels impossible to ignore. But that is not usually how blood pressure causes trouble. In real life, the body is often affected much earlier, and much more quietly, by numbers people dismiss as only a little high. I am Dr. Warren Hung, a medical doctor, and this is one of those health topics that often sounds simple until you look closely at what the body is dealing with day after day. If you like clear, practical health explanations without medical jargon getting in the way, subscribe and stay with me. When you check your blood pressure and see two numbers, the first one, the top number, is called systolic pressure. That is, the pressure inside your arteries when your heart squeezes and pushes blood forward. The second number, the bottom number, is called diastolic pressure. That is, the pressure when your heart relaxes between beats. Put simply, the top number shows the force of the push, and the bottom number shows how much pressure remains in the system when the heart rests. That may sound technical, but the meaning is very simple. Blood pressure is a measure of how hard the blood is pressing against the inside of your blood vessels. And after 60, that matters more than many people realize, because the blood vessels themselves often start to change. When we are younger, arteries usually have more flexibility. They expand more easily when blood moves through them. With age, those artery walls often become stiffer. Not always, and not at exactly the same pace in every person, but often enough that it changes what a blood pressure reading means. A stiffer system handles pressure less gracefully. That means a reading that seems only mildly high on paper may be creating more strain inside the body than a person expects. This is where many people get misled. They think the danger starts only with a crisis reading. They picture numbers so high that they would have to feel something dramatic right away. But high blood pressure often does not work like that. It can build quietly. It can stay in a range that feels almost normal. It can show up in a reading that gets brushed off because the person had a stressful morning, had coffee, slept badly, or rushed to the appointment. And to be fair, one reading does not tell the whole story. That part matters too. A single blood pressure result can be pushed higher by pain, worry, nicotine, exercise, a full bladder, talking during the reading, sitting in the wrong position, or even using the wrong cuff size. That is why one isolated number should not be treated as a life sentence. But the opposite mistake is just as common. People use that truth to ignore a pattern that is becoming more consistent. After 60, that pattern matters. A blood pressure reading in the 130/80 range is not something to panic about, but it is not something to shrug off either, especially if it keeps showing up. And when readings move into the 140/90 range or higher, that is usually no longer just a small drift away from ideal. That is a sign the pressure inside the arteries is regularly stronger than it should be. Now, the question people often ask is very direct. How high is too high after 60? The honest answer is that there are clear numbers doctors pay attention to, but the true risk depends on more than one snapshot. The body does not care only about the highest number you have ever seen. It also cares about how often the pressure is elevated, how long it stays there, and whether important organs are being exposed to that extra force over time. Think of it like water moving through plumbing. If the pressure spikes once because someone turned something on suddenly, that is one thing. But if the pressure stays higher than it should day after day, month after month, the stress adds up. The pipes do not always burst right away. Sometimes they slowly wear down. Blood vessels can behave in a similar way. They can become damaged gradually, and because that process is slow, people often feel perfectly normal while it is happening. That is one of the most dangerous parts of high blood pressure after 60. You may feel fine, no headache, no dizziness, no warning that seems dramatic enough to make you stop and think something serious is going on. Meanwhile, the heart may be working harder to pump against that pressure. The arteries may be under more strain. The brain, kidneys, eyes, and heart may be dealing with a burden that is not obvious yet. Have you ever had a blood pressure reading that looked high, then told yourself it did not count because it happened during a stressful day? That is a very common reaction. Sometimes it really is just a temporary rise. But when the same kind of reading starts appearing again and again, that is when it deserves real attention. What I want you to take from this first part is simple. After 60, blood pressure should not be judged only by whether the reading looks shocking. A number does not have to look extreme to matter. Repeated readings around 130/80 deserve attention. Readings around 140/90 or higher usually deserve much more than a casual promise to keep an eye on it. And the reason this matters is not only the number itself, but what that pressure may be doing inside blood vessels that are not as flexible as they once were. Once those vessels start losing that flexibility, the top number begins to tell a more serious story than many people realize. Once arteries start losing some of their flexibility, blood pressure changes in a way that can fool people. The reading may not look terrifying, the person may not feel sick, nothing dramatic may happen that day. But the top number can begin creeping upward for a reason that has very little to do with how someone feels in the moment, and a great deal to do with how the circulation system is aging. The top number, the systolic pressure, is the force created when the heart contracts and pushes blood forward. In younger arteries, that pressure wave is absorbed more smoothly because the vessel walls still have more give. They stretch, then return to shape. It is a little like pressing water through a hose that still has some softness to it. The system can adapt. It can cushion the push. After 60, that often changes. The arteries may become stiffer from aging itself, but also from years of inflammation, plaque buildup, diabetes, smoking, kidney disease, lack of activity, or long periods of poorly controlled blood pressure. A stiffer artery cannot absorb that pressure wave as easily. So when the heart pumps, the force hits harder. That is one major reason the top number becomes so important with age. This helps explain something that confuses many people. They see a blood pressure reading like 152/78 and focus on the lower number because it does not look especially high. They think the bottom number seems reasonable, so the overall reading must not be too bad. But after 60, that pattern can still be very concerning. The top number may be high because the arteries are no longer handling pressure the way they used to. This is sometimes called isolated systolic hypertension. That simply means the top number is elevated while the bottom number is not as high. The medical term may sound complicated, but the idea is straightforward. The body is telling you the pressure of the pump has become harder on the arteries, especially during each heartbeat. And that repeated force matters. Why does it matter so much? Because the heart, brain, kidneys, and eyes all depend on healthy blood vessels. They are not protected just because there is no pain. High blood pressure does not need to cause obvious symptoms to cause damage. In fact, one of the reasons it is so dangerous is that it often stays quiet while the stress continues. Take the heart first. When pressure in the arteries stays high, the heart has to push against more resistance each time it pumps. Imagine trying to push open a heavy door over and over again instead of a light one. You can do it, but it takes more work. Over time, the heart muscle may thicken in response. At first, that can sound like strength, but in this case, it is not a good sign. A thickened heart muscle can become stiffer, less efficient, and more vulnerable to rhythm problems and heart failure. Then there is the brain. The brain depends on a steady, well-regulated blood supply. Blood vessels there are delicate. Persistent high pressure can damage them gradually, increasing the risk of stroke, small vessel disease, and changes that affect memory and thinking over time. The scary part is that someone may feel perfectly normal while those vessel changes are developing. No alarm bell goes off early enough to make the danger obvious. The kidneys are another place where this hidden strain can show up. They are filled with tiny filtering structures that rely on healthy circulation. High blood pressure can damage those filters slowly. When that happens, the kidneys become less able to do their job, and damaged kidneys can then make blood pressure worse. It becomes a cycle. Pressure harms the kidneys, and kidney trouble pushes the pressure higher. The eyes can also tell part of the story. The small vessels in the eyes are sensitive to pressure changes. Persistent hypertension can affect them too, which is one reason doctors sometimes look into the eyes for signs of vascular damage. Vision changes do not happen in every case, and they often do not happen early, but the eyes are one more reminder that blood pressure is not just a number on a screen, it is force moving through real tissue. This is why "I feel fine" can be such a misleading sentence. Feeling fine is good, everyone wants that, but it does not prove blood pressure is safe. High blood pressure is often called a silent problem for a reason. The silence is part of the risk. Many people expect the body to warn them clearly when pressure becomes dangerous. Sometimes it does, but often the clearer warnings come late. You may have met someone who says, "My pressure runs high, but that is just normal for me." That kind of thinking can be comforting, but the body does not really work that way. Your body does adapt to some degree, but that does not mean the pressure is harmless. Getting used to a higher number does not protect the blood vessels from the wear that number can cause. At the same time, this is where nuance matters. Not every person over 60 should be forced into exactly the same target without context. One person may have diabetes, another may have kidney disease, another may have had a stroke, another may be frail, prone to dizziness, or at risk of falls. Someone else may tolerate medication very poorly. So while it is true that a systolic reading in the 140s, 150s, or higher deserves real attention, the best treatment goal still depends on the full person, not only the monitor. That is why blood pressure management is not just about lowering a number at any cost. It is about lowering risk while keeping the person safe and functional. A good plan should reduce strain on the arteries, heart, brain, and kidneys without making the person weak, lightheaded, or unsteady. This balance matters even more in older adults. Still, one message should be very clear. A top number in the 140s, 150s, or 160s should not be ignored simply because the bottom number looks decent or because there are no symptoms. After 60, the top number often tells the more important story. It can reflect stiffening arteries, rising vascular strain, and silent risk that builds over time. If you check your readings at home, have you noticed that your top number is the one that tends to stay up, even when the bottom number looks less alarming? That pattern is common, and it is exactly why older adults need to understand what systolic pressure is really saying. Because once you realize the same reading does not carry the same meaning for every person, the next question becomes even more important. What makes one blood pressure number more dangerous in one body than in another? This is the part many people never hear clearly enough. A blood pressure number matters, but the number is not the whole story. Two people can sit in two different chairs, have the same reading on the monitor, and carry very different levels of risk. Let's say both people have a reading of 145/85. On paper, that looks identical. But imagine the first person is active, has no diabetes, no kidney disease, no history of stroke, no heart failure, does not smoke, and has otherwise stable health. Now imagine the second person has diabetes, reduced kidney function, a past mini-stroke, and takes several medications that affect circulation. The same blood pressure reading may place a much heavier burden on the second person. That does not mean 145/85 is harmless for the first person. It means context changes the meaning of the number. Blood pressure is not happening in isolation. It is happening inside a real body, with a real medical history, real blood vessels, real medications, and real limits. This is where medicine becomes more careful than people expect. The public often wants one simple answer. Just tell me the exact number that is too high after 60. And while there are ranges that clearly deserve attention, the truth is that doctors are also looking at the pattern behind the number and the person attached to it. For example, diabetes changes the picture because it can quietly damage blood vessels over time. The kidneys are affected by both diabetes and blood pressure, so when those two problems happen together, the risk can rise faster. Kidney disease changes the picture because the kidneys help regulate fluid balance and blood pressure itself. If they are struggling, pressure can become harder to control, and high pressure can damage them even more. A previous stroke changes the picture because it tells you the circulation system has already shown signs of vulnerability. Smoking changes the picture because it damages blood vessels and increases strain on the heart and arteries. Heart failure changes the picture because the heart may already be working under difficult conditions. So the number matters, but the body's background matters too. There is another piece people miss, and that is the pattern over time. One reading tells you what happened in one moment. A pattern tells you what your circulation is dealing with every day. That is why home blood pressure readings can be so helpful when they are done correctly. They give a more honest picture of what is happening outside a clinic, outside the stress of a rushed appointment, and outside the pressure of being told to sit down and relax while knowing someone is about to evaluate your health. You may have heard the term white coat hypertension. That means blood pressure looks higher in a medical setting than it usually is at home. Some people get nervous in clinics, and the reading rises. That is real. But the opposite can happen too. A person may look fairly normal in the clinic and run high at home during regular life. That is sometimes called masked hypertension, and it can be easy to miss if nobody checks outside the office. That is one reason good home monitoring can be so valuable after 60. Not obsessive checking, not taking it every 15 minutes, just consistent, calm, correct measurements, taken in a way that actually tells the truth. Technique matters more than people think. If the cuff is too small, the reading can come out falsely high. If the arm is hanging down instead of supported at heart level, the reading can shift. If the person just walked upstairs, had coffee, smoked, talked during the reading, crossed their legs, or sat down for only 30 seconds before pressing the button, the result may not reflect the body at rest. The goal is to make the reading boring. Sit quietly for a few minutes. Use the correct cuff. Keep your back supported. Rest your arm. Keep your feet flat. Do not talk. Then take the reading. That sounds simple, but small mistakes can create enough noise to confuse the picture. Morning readings can be especially useful. Blood pressure often follows a daily rhythm, and some people have higher readings early in the day. That pattern can matter. Evening readings can matter too. A single number is less powerful than a record that shows what happens across several days, especially when the readings are taken the same way each time. And then there is something else older adults need to hear clearly. Lower is not always better if the price is weakness, dizziness, falls, or fainting. This is where blood pressure treatment has to be individualized. A person can have pressure that is technically lower, but if they feel unsteady every time they stand up, that can create a different kind of danger. Falls can be devastating after 60. So the goal is not to chase the smallest number possible. The goal is safer, healthier pressure that the body can tolerate. That is also why medication decisions should never be changed casually without guidance. Some people see a few lower readings and decide to stop a pill on their own. Others see a high reading and double a dose without being told to. Both can go badly. Blood pressure medication interacts with the kidneys, fluid balance, heart rate, and other prescriptions. Adjustments need to make sense in the full medical picture. A much better habit is to keep a useful record. Write down the date, the time, the reading, and whether anything unusual was happening. Were you stressed? Did you feel lightheaded? Was this before or after medication? Did you have a salty meal the night before? Was the reading taken properly? Patterns like these help a clinician understand whether the issue is persistent, medication-related, timing-related, or partly due to the way the readings are being taken. This is also where symptoms matter, though symptoms alone are never enough. A person with repeated readings in the 140s or 150s may feel completely normal. Another person may feel pounding in the chest, headaches, flushing, or anxiety. Those feelings can matter, but they do not always match the degree of danger. Some very high readings produce little warning. Some uncomfortable symptoms happen with readings that are not truly severe. That is why symptoms add context, but they do not replace the number. So when you ask how high is too high after 60, a better version of the question is this: how high, how often, under what conditions, and in what kind of body? That is the question that leads to safer decisions. The person with diabetes, kidney disease, or prior stroke may need closer attention even if the reading does not look dramatic. The person who gets dizzy when standing may need a more careful balance even while treating hypertension. The person whose blood pressure is high only in the office may need confirmation at home. And the person whose readings are repeatedly elevated in quiet home conditions should not assume that because life feels normal, the number does not count. If you have ever checked your blood pressure at home, do you keep a real pattern, or do you mostly remember the readings that scared you? Most people remember the dramatic ones. What helps a doctor more is the pattern nobody can see from memory alone. And once you start looking at the pattern that way, the next question becomes much more urgent, because some readings should be watched and discussed, while others should never be brushed aside or left for later. So now we come to the practical question people really want answered. Not in vague terms, not in a general lecture. What numbers should make you pay attention? What numbers should make you act? And what numbers should make you get help right away? The first thing to say is this: blood pressure is not judged only by panic level readings. Trouble often starts well before that. After 60, if your readings are regularly landing above the healthy range, even if you feel completely fine, that deserves attention. If the top number is between 120 and 129 and the bottom number stays under 80, that is considered elevated. That may not sound dramatic, and it is not the kind of reading that usually sends someone rushing to urgent care, but it is still a sign the pressure is starting to drift in the wrong direction. For an older adult, that matters. It is the kind of number that says, do not ignore this early. Watch the pattern. Look at salt intake, activity, body weight, sleep, alcohol, stress, and medication effects. Catching the drift early is always easier than dealing with a well-established problem later. Once readings are repeatedly in the 130 to 139 range on top, or 80 to 89 on the bottom, that moves into a range that should be taken seriously. This does not mean everyone in that range is in immediate danger. It means the body is spending more time under pressure than it should. For some people, especially after 60, that is the point where a conversation with a clinician should already be happening if it has not happened yet. The right response depends on the full picture, but the wrong response is pretending that range is harmless just because it is common. When readings are regularly 140/90 or higher, that is a stronger signal. At that point, blood pressure is no longer just nudging out of range. It is high enough that it often needs closer follow-up, and for many people, it will mean treatment has to be reviewed, strengthened, or adjusted. Again, Not because one single reading appeared after a stressful day, but because the pattern is showing the arteries are being exposed to more force than they should be. This is where I want to be very clear. A person over 60 should not brush off a repeated reading in the 140s or 150s just because they are walking around, cooking dinner, paying bills, and feeling normal. Functioning normally is not proof that the pressure is safe. The body can absorb a lot before it starts sending obvious warnings. That is part of why so many people are shocked when blood pressure finally does cause a visible problem. Then there is the range that deserves much more immediate attention. If you check your blood pressure and the reading is over 180 on the top number and/or over 120 on the bottom number, that is not something to casually ignore. But even here, the next step matters. If you have just climbed stairs, had an argument, rushed across the house, or taken the reading improperly, sit down, rest quietly, and recheck it after several minutes. Do not keep taking it every 30 seconds. Do not spiral into panic. Recheck it correctly. If it stays that high, you need prompt medical guidance. And if that kind of reading is happening along with certain symptoms, that changes the situation completely. Chest pain matters. Shortness of breath matters. Severe weakness matters. Numbness on one side matters. Trouble speaking matters. Sudden confusion matters. New vision changes matter. Severe back pain matters. Those are not details to wait on. If a blood pressure reading is extremely high and symptoms like these are happening at the same time, that can signal a hypertensive emergency or another serious medical event, and emergency help is needed. This is one of the most important distinctions in the whole discussion. A very high number without symptoms is still serious and should not be brushed off. A very high number with concerning symptoms is a different level of urgency altogether. Now, some people hear this and immediately think, what if I get one bad reading and overreact? That is a fair concern. The answer is not to underreact. The answer is to respond in an organized way. If the reading is mildly elevated, do not panic. Start tracking it properly. If the reading is repeatedly in the 130s over 80s or higher, do not wait months pretending it will sort itself out. Begin documenting it and discuss it with your clinician. If the reading is repeatedly 140 over 90 or above, that deserves more direct attention. If the reading is above 180 and or above 120, stop, rest, and recheck correctly. If that extreme reading stays there, contact a healthcare professional promptly. And if that extreme reading comes with chest pain, trouble breathing, weakness, numbness, difficulty speaking, severe headache with neurological changes, or vision loss, treat that as an emergency. That simple framework helps people think clearly when emotions rise. There is also something else older adults should keep in mind. Do not make medication changes on your own because of one high reading, unless you have already been given a clear plan by your own doctor for that situation. Do not double doses because you are frightened by a single number. Do not stop medication because you had a few decent readings and assumed the problem is gone. Blood pressure can change with hydration, illness, kidney function, heat, diet, and other medications. A safe adjustment needs context. What helps more than panic is preparation. Keep a written log. Write down the date, time, blood pressure, reading, and any symptoms. Note whether you had taken your medicine yet. Note if the reading was taken after resting. That kind of record is far more useful than saying, my blood pressure has been kind of high lately. And ask practical questions. Is my cuff the right size? Am I taking the reading correctly? Are my morning readings different from my evening readings? Could one of my medications be affecting the pattern? Is my blood pressure dropping too low when I stand? Is there any sign my kidneys, heart, or circulation need closer evaluation? Those are the kinds of questions that move the conversation from fear into useful action. So, after 60, how high is too high for blood pressure? High enough to matter often starts earlier than many people think. Repeated readings in the 130s over 80s deserve attention. Repeated readings in the 140s over 90s or higher deserve real follow-up. And readings above 180 over 120 move into a range that should never be brushed aside, especially if symptoms are present. The goal is not to scare you. The goal is to help you recognize that blood pressure is one of those problems that is easiest to manage when you respect it before it becomes dramatic. Numbers do not have to look shocking to be harmful. Quiet strain still counts. Repeated strain still counts. And catching that pattern early can make a real difference in protecting the heart, brain, kidneys, and blood vessels in the years ahead. If this helped make blood pressure easier to understand, subscribe for more clear health explanations like this. And if there is a part of blood pressure that still confuses you, leave it in the comments, because that question may help someone else too.